Good morning, class. It's Monday morning for me, and you'll be looking at this on Wednesday or Thursday, Friday, Saturday, Sunday, Monday, Tuesday. Have it completed by next Wednesday. Hope everybody's doing well. I know we had a transition, so some of you are on campus, some of you are at home. Um, Again, bear with me. This is always a learning curve when you're directing online classes. Wish we could be in person. It's a lot more fun. I can obviously see your lovely faces and interact and those type of things, and hopefully that'll soon occur. So today we're looking at adult CPR with an AED, the defibrillator. Um, if you aren't aware of where a defibrillator is located in your building, if you were in the MAC building where my class normally is held, there is one down at the gymnasium as you walk down the steps onto the left if you're entering from campus side. It's always good, again, to know that even in your shop classes or at your place of work. And so let's go. Here we go. Adult CPR with an AED.
Using an automated external defibrillator, commonly referred to as an AED, in combination with CPR, may be more effective than CPR alone. An AED helps the heart re-establish an effective rhythm and works alongside CPR to provide the best possible care. Best of all, AEDs are simple to use. You just have to turn it on and follow the prompts. In situations with multiple trained responders, one can continue CPR while the other applies the AED. Many AED kits come with adult and child-size pads, gloves, a breathing barrier, a dry cloth, scissors, and even a razor, which should be used if the person has excessive chest hair. First, the AED will prompt you to expose the person's chest. Next, the AED will prompt you to attach the pads as shown on the pads. From there, the AED will analyze the person's heart rhythm and determine if a shock is advised. No one should be touching the person while the AED is analyzing or delivering a shock. It's your job to tell everyone to stand clear. It may sound like a lot, but remember, the AED is going to tell you exactly what to do and when to do it. With multiple trained rescuers, you can continue CPR while the AED is being applied, but it's important to stop during analysis. After the machine analyzes, it will say either shock advised or no shock advised. This is the time for the second responder to get into position for chest compressions. Continue providing care until the person shows obvious signs of life, you have performed 5 sets of CPR, and another trained responder is available to switch, or EMS personnel take over, you are too exhausted to continue, or the scene becomes unsafe.
Pause at this time. Okay, at this time we're going to go to the skill practice with adult CPR and the AED.
There are some situations that may require special attention when using an AED to provide care. For example, using an AED around water may not
Sorry, I need to pause. My dog is barking. 1 second. Okay, apologizing. My dog was barking, and we are going again to the adult CPR skill practice with an AED.
There are some situations that may require special attention when using an AED to provide care. For example, using an AED around water may not seem appropriate, but AEDs are actually safe to use near water when all precautions and manufacturer operating instructions are followed, even in rain and snow. If a person is actually in a pool or puddle of water, move the person before using the AED. Thoroughly dry the chest before applying pads. If it's raining, try to shelter the person from the water, but don't delay care to create a dry environment. Another special situation to pay attention to is if a person has an implanted medical device or a medication patch on their body. For implanted devices, like a pacemaker or implantable cardioverter defibrillator, avoid placing the pads directly over the device. Implantable cardioverter defibrillators, also known as ICDs, are like miniature AEDs. Pacemakers and ICDs are typically located in the area below the person's right collarbone, and they feel like a small lump under the person's skin. Remove any medication patches on the person's chest with a gloved hand and wipe away any medication before placing the AED pads. Finally, Metal surfaces and items. It is safe to deliver a shock to a person who is laying on a metal surface, like bleachers, as long as the pads themselves do not touch the metal surface. It's also safe to do so when a person has body jewelry. Just make sure you avoid putting the pads directly over any jewelry. Keep them about an inch away just to be safe.
Okay, the briefing summary, if you look through that one more time. And now we'll go to the skill practice. When we utilize the skill practice, there's a number of different options. I will not always click on the exact answer, just to give you some familiarity to what people may think or may do. But again, we'll get to the exact format as we go through the mission. Here we go. Start the mission.
After finding Jack on the floor, you grab the AED from its place. Use the check, call, care process to respond to this emergency.
So we check, call, care, always.
Good. You've checked the scene, and there don't appear to be any hazards. The scene is safe. While checking, you didn't notice any severe, life-threatening bleeding.
So we're going to talk to the gentleman. Remember, we're in the scene, but are not seen.
Yeah, I'll go call 911 right away. Good work. Mike will now step away to call 911. It's critical that you alert emergency services as soon as possible during a cardiac emergency. Before you engage with bystanders, you should check the scene and check the person for responsiveness.
So when we check for responsiveness,
What is the correct way to check for responsiveness?
let's just verbally do it first.
Jack doesn't respond. How do you complete your check?
We're going to tap on the shoulder again, not anything deliberate that would hurt the individual or cause more harm.
Jack is unresponsive. During your check, you noticed he isn't breathing either. What's next? Now open the airway.
Okay, so when we look, we go to a tilt. This would be way too far, not far enough, and we're going to go right to there.
Jack's airway is now open.
So once we get the airway open, start performing chest compressions.
Position yourself for chest compressions.
And you can see how we move where the knees are. And we're going to go about approximately right there. Let's see.
Nice job. Next, drag the correct hands to the correct location on the chest for compressions.
Let me move my picture here so I can grab these hands and you can see which way. Interlocked. And we see the chest where the sternum is. Okay?
Not quite. Try again.
Let's go.
Not exactly. Use two hands in the center of the chest on the lower half of the sternum.
Okay, you go.
You'll need to count compressions on your own. Remember, give 30 compressions at a rate of 100 to 120 compressions per minute. When you've completed chest compressions, select the Done button.
Ready? Here we go.
You have an AED available. You should have used it before performing compressions.
Okay, when you do the compressions, you should count to yourself, or you can count out loud to the 30 compressions.
Remove clothing from person's chest. Attach pads firmly to person's chest, as shown.
Nice work. Now, follow the AED prompts to continue providing care for Jack.
So we would, let's go to the prompt. We remove clothing. Let's see what it says about attaching pads.
You need to expose the chest before you can attach the AED pads.
See if we can do that.
Nice job. Jack's chest is now exposed.
Go back to the AED.
Drag each pad to the correct spot on the chest.
Okay, so you can see the pictures on the pads. So this one would be on the lower part right here.
Not exactly.
Well, we're going to look and
Use the
see.
illustrations on the pads as a guide. Try again. Place one pad on the upper chest near the collarbone and the other one at the rib cage below the chest. You have attached the AED pads.
Analyzing rhythm. Everyone stand clear.
So when this talks about everybody tell bystanders to stay clear.
Shock advised. Charging. Everyone stand clear. Push the shock button. Shock delivered. Begin 5 cycles of CPR.
So at this time, you would start your CPR process. You'd open the airway, give rescue breaths. Okay, again, we position ourselves.
You gave 2 rescue breaths. However, you forgot to open the airway first.
Okay, and what?
Remember, Jack's head will move during compressions, so you need to open the airway every time you give rescue breaths.
Okay, an ambulance is on the way. The operator said you should keep doing what you're doing until they get here.
Okay, to talk you through this one more time, you complete that cycle until, again, if you see the person, if the heart, does start to beat and they start breathing, obviously, you would stop your CPR. Continue until emergency medical technicians or team gets there. And so you saw today with this approximately 15-minute video, CPR. Okay, again, open the airway. Compressions, 30 compressions to the song, if you can think about it, Staying Alive, staying alive, and I can't sing. And then also with your 2 rescue breaths, when you look at the rescue breaths, when you give those, you can, at that point in time, you can even hear a little bit, but when you give those rescue breaths, if you don't have something to cover the mouth or nose, obviously, you can start, but if there's blood present, you can use a barrier in between. Very rare, extremely rare to transmit any type of disease or illness. Unfortunately, with the pandemic, with the COVID issue, at this point in time, we would strongly recommend a barrier, and I'm sure some people would be hesitant, but again, you're there to save a life. Let's go to the end of this. I might throw another video in that you can watch. We'll look at CPR and AED. Again, next week, we'll look at some infant things. We're going to talk specifically about heart attacks and strokes. I wish you all the best. Hope you do well. Remember, there'll be a quiz at the end of this lesson, 5 to 6 questions probably. If at any point in time you do have questions, email me. I wish you the best. Take care.